If you have any topics that you would like me to talk about in the future, just write them in the chat and I will put them in the poll for next month. So now let's go to the Q&A part. Why do I pick so much? It's killing me. So that's a very general question. I gotta say, I can give you a general answer which may or may not apply to you, but since that's the kind of question that you asked, that's the kind of answer I can give you. So typically, for most people, we look at skin picking as a way to cope with, but avoid processing difficult experiences, whether it's discomfort, anxiety, tension, some other emotion, memories, thoughts, and so on. So that would be the most generic answer that I can give you. Oh, by the way, I made a mistake here. So there's a new code. If you're interested in joining the program, you'll get $100 off from the first month. So the code is webinar 100, but I didn't change the 60 here, so it should be 100. Anyway, back to other questions. When I tried journaling a while back, I found I picked all the time. Does anyone else have this problem? Seems to be worse than usual. Well, yeah, that is something that happens, but only because journaling kind of, I just, in the first question that I answered, I mentioned how picking helps you avoid certain emotions or thoughts or memories. Journaling brings you, in touch with these. In that case, maybe like the things that I listed here, maybe that's not the best place for you to start journaling. In the webinar about discipline, I think I mentioned a very simple daily journaling thing that I do for myself as well. So that I love journaling, so I have like a gazillion journals. And I have one where I just write in few sentences, I summarize my day. I will write what I did well, what I could have done better in hindsight. And then I'll kind of try to summarize my day in one sentence and say, what my lesson for the day is. And sometimes if I'm feeling particularly in need of kindness, I will end the entry with like a nice message to myself. And that takes about 5 to 10 minutes to do, depending on what your day was like. And because you're thinking about what you did well and where you can improve, you avoid the whole self-judgmental thing, and you also avoid dwelling on painful memories. So maybe that's a way to start journaling. And then later on, you can maybe introduce some specific journaling prompts, but slowly and step by step without being too invasive. I think these avoidance mechanisms, kind of like with dissociation, like when you work with people who tend to dissociate, the same way with people who tend to avoid a lot, you don't want to overwhelm them with everything at once. You want to introduce those things slowly so that they have time to absorb something until something else appears. So maybe if your journaling was like straight to the point, just diving deep right away, maybe that's not the way to approach it. Sometimes it's also good to journal around picking. So you don't have to make picking like the focal point of your journaling. Sorry, something weird is happening on my screen. Okay. So what you can do is you can journal about other aspects of your life, and then try to kind of see if there are any connections to picking, write it down, and then leave it. And then review that after a while, see how you feel. And if you feel strong enough, then go a little deeper. So just take it step by step. Journaling is quite helpful if you're in therapy. If you're outside of therapy, journaling is quite useful. Just don't force yourself. I'd like to attend a webinar that compares therapy for skin picking to therapy for addiction. What are the differences between behaviors, habits, and addictions? What are the neurological differences? Okay, I will put that, just let me write that down right away so that I don't forget. And I will put that in the poll for next month so that you can vote for it. Okay. So it'll be in the poll next month. And if there's anyone else interested in the topic, feel free to vote for it, and I will happily do that webinar. Let me see what else we have here. I used to be able to join in the virtual support group. What happened to that? I haven't been able to connect with the group. Please advise. So I don't know why you haven't been able to connect with the group. I mean, we still have. If you're talking, if you're talking about, I know that Picking Me Foundation has support groups. They work. I'm in semi-regular contact with them, so I know that they work. Our support groups also work. I'm not sure why. Are you paying? So just pay attention to the newsletter, and you will get the links with the dates and times. We're actually about to introduce a little additional groups, at least for our paying members, but free groups are still there, and you're more than welcome to join them. If you can't find it anywhere, you can email me. You have my email here in the lower left corner. I will send you the links to sign up for. I think we have groups planned certainly a month and a half in advance, so you can sign up for all of them as far as I'm concerned. You can attend groups once a week. Sometimes it happens that they book up. Maybe that's what happened. We only allow 15 people to join the group at once because there's simply no point in having a group where half of the people don't have a chance to say anything. So maybe if you registered late, there were no slots open. That's the only thing that comes to my mind. But please email me and we'll figure it out. This is not a question, but a comment. I'd like to commend much of what you said about change not being linear. I love the line, there's no success without failure. I just experienced a relapse and I stopped using NAC last fall because I was doing so well. And I wish I was more patient. I'm trying and I appreciate your webinars despite what I think should be discipline is my superpower. So I'm working on patience. Thank you. Well, you're welcome. And that is true. And I think I don't even think this is, if I'm being perfectly honest with you, I don't even think this expectation that change should be linear and fast. I don't even think this is any of my clients' fault. I think overall, we live in a culture that likes these kind of quick results and hacks and everything. And then in addition to this, CBT really, in its entire existence, for how long it's been around, since the 60s, has this marketing around it that it's fast, it's efficient, it's no nonsense. Initially, they used that to differentiate themselves from psychoanalysis because psychoanalysis was supposed to be slow and inefficient, whereas the CBT people are, like the efficient good ones. But even with CBT, it just doesn't work that quickly, like because we're human, we're not machines. So yeah, I think I don't have that much of a voice in, in the broader kind of community. I can't change the discourse around therapy, but at least I can repeat my point here over and over again. Yeah, I change quite quickly because I'm very disciplined, and I tend to be quite a patient person. Um, but I still don't change easily, and I fail all the time. I think yeah, I really I'm very bad at changing, but it is what it is. You have to work with what you have. Um, I was talking about myself just now, not changing other people. That I know how to do better. It's easier. Um, Useful small steps appear to be the way to accomplish the goal, but how would you reward yourself? Well, that really depends from person to person. I don't know. So I usually like to tell people to have few tiers of rewards. So you should have something small, like you have, let's say, if you set the goal, I don't know, not to pick in the bathroom for 1 week. You can maybe still pick in some other places, but not in front of the mirror. Let's have that hypothetical situation. And you say, I won't pick for a week, and then you don't pick for 3 days, you can have a small reward. I don't know, like if you're on a diet, get a candy, like some guilty pleasure. And then after a week, get something bigger for yourself. So have several tiers of rewards. What a reward would be for you is really very individual. So I know, since I know who sent the message, I this is a topic that we've been discussing recently. What you proposed as a reward seemed quite fine to me. I don't want to disclose the details since this is your private information. But my clients will usually have that, or they will take a trip somewhere, or they will do something nice for themselves, like, I don't know, like see a cosmetician, get a new, have your hair done, whatever. So anything that will give you pleasure. The reason why I insist on rewards is that our brains don't. So when you do something well and that goes unnoticed, for your brain, it's a non-event then. Like it's just an ordinary neutral memory. If you do something wrong and you get upset with yourself, the only message that your brain carries from that is don't do this. And don't do this is not very useful information. Like imagine if you're asking me for directions and I tell you, like, when you just continue going like straight ahead, and then when you reach the crossroad, don't go left, and then on the next crossroad, by no means should you go right. Would you possibly know where to go? Of course not. And your brain doesn't either. So when you get upset with yourself because you've experienced a little relapse, your brain only understands, I don't want this. It's kind of like puppy training. Like we're really not that more evolved than dogs. Like I trained my dog without ever having to yell at her because I would just give her a cookie when she does something well. And if she gets a cookie once, that is immediately a habit for her because my dog likes to eat quite a lot. So for her, that always works. That's why rewarding yourself is important because your brain will immediately know, okay, so this is what I should be doing next time. But what that reward is, like for me, it might be, I don't know, additional time to read because I like to read. And if I have more time to read fiction, I will take it. That'll make me very happy. If I don't know, if I set a goal for myself to do something for a week, I will reward myself with a trip somewhere because I like to travel. And I'm perfectly happy traveling like to a nearby village where there's nothing except a tree and a church, and I'll just be happy staring at it. So for me, that's a reward. Going to the beach is a reward for me, but it might not be for you. So you have to see what makes you happy, what small pleasures are specifically and authentically yours. How do I control my picking on ADHD medication? So there are anything from the habit reversal training palette of techniques should work. Um, you can also consider, so depending on where you are and who your physician is and what your insurance will cover, you can even have your ADHD medication changed because stimulants are not the only ADHD medication available. They're just what's prescribed the most, but it's not the only available. So maybe your doctor can change the medication, adjust the dosage. But if you're thinking solely in psychological terms, then I don't know exactly how your pattern is, but what I see most frequently is that evenings are risky because those are the periods of time when the medication wears off, and for some reason that's when people pick the most. So it's usually predictable. That means that maybe you can employ stimulus control techniques ahead of time in for those specific times or places. And then stimulus control will prevent you from picking or prevent the urge from coming about. So that's something that you can do. But otherwise, we had two webinars on different aspects of habit reversal training, so you can take a look at those, and I'm sure you'll also find convenient techniques. This isn't really a question. After recently being diagnosed with ADHD, I decided to try a stimulant medication. I was worried my skin picking might increase. In fact, it's almost stopped completely. I also have less anxiety. Yeah, this is also quite possible. And unfortunately, the way I'm not quite sure. I've seen both reactions. I've seen people who actually started picking when they started ADHD medication, and then I've seen stories like this. So it seems to have like a dual effect. And Which one will prevail? I can't figure out for the life of me. Uh, in your case, there's a connection between anxiety and ADHD, and there's also ADHD as a part of the clinical presentation. Usually, impulse control is a bit of an issue. So all that will exacerbate picking, and then if you actually deal with the ADHD, then theoretically at least that should reduce picking as well. And also people get very easily frustrated because when it's so hard to focus on one thing, then you naturally become more anxious. It's just a healthy, normal response to not being able to direct your attention where you want it to be when you want it to be there. So if that goes away, then maybe your anxiety levels are also lower. If you're studying or working, perhaps you can do more than you could before. That can affect how you see yourself, and as a result, you can reduce picking. I wonder, and this is just me thinking out loud, so please don't take this as anything even remotely solid. But I think ADHD is one of those things that are kind of overdiagnosed and very easily diagnosed. So I'm wondering if maybe the reaction to medication might actually be an indication of whether or not someone has ADHD, or maybe they have something else that resembles ADHD. What frequently happens is that psychiatrists or general physicians, whoever you see, that they have so little time to devote to their patients that they just jump at the first obvious diagnosis instead of spending more time with you and then really analyzing it. So maybe that's a way to explain it. There are no studies on the subject matter, so I'm talking out of my what. But that's also something that could be the case, because typically, our biochemistry is always the same, so medication should have roughly the same effects. What should we do if we already have a therapist who isn't as knowledgeable about skin picking, with whom we have meetings only once a month? Would it be better to leave them and join this program? Well, whether you will, I feel kind of, I don't know, I feel awkward telling you quit your therapy and join our program because I work for the program. So I don't know. It just doesn't seem like something I should say. And it's not necessarily something I think. There are a few things here that you said that I would like to address. One, if your therapist isn't knowledgeable about skin picking, they should just learn. When I had my first client who struggled with skin picking, I wasn't knowledgeable about skin picking either. But then I saw this client and I had it was actually a client with hair pulling. That was my first BFRB case. I had no idea what I was doing. And then I thought, maybe I should learn. And then I did. So there's a lot of material there. Your therapist can reach out. I'd be more than happy to give them advice and help them out. I help out colleagues all the time. They email me and ask for resources and help and consult with me. I would be more than happy to do that. There's absolutely no excuse. That's just so frustrating. I feel like whenever a therapist tells you, I don't know how to treat this issue, and that message doesn't include, but I will learn, I just wouldn't go to them because I would feel like they're being lazy. Like, as a therapist, you never know what problems your clients will bring. Even skin picking is not one thing. I hope you've noticed how frequently I emphasize the fact that different people will have different experiences, different causes, different triggers, different consequences. So there's no such thing as a therapist who knows everything. So if your therapist doesn't know, they should just learn. How hard is it, for crying out loud? So that's my part of the frustration. And then second of all, I also don't see a lot of benefit to seeing your therapist once a month, because therapy requires a certain pace. Like, if you see your therapist once a month, I'm guessing you'll spend half of the session just telling them what happened in the previous month, and that will be a rough outline. And then the rest of the session, you'll be talking about something without your therapist having, the full picture of how things are. So I don't see a lot of benefit from that pace to begin with. Usually, I insist on I'm talking as a therapist and who has his own private practice. I usually insist on sessions once a week. if a client is good and if we're planning to slowly finish therapy, then maybe we can have once in 2 weeks for a while, and then even maybe fewer and far in between afterwards. But that's for the specific goal of creating that separation from the therapist in a painless way, so that the client feels stable and independent enough to continue on their own. Um, I wouldn't. I wouldn't I wouldn't see much of a point in seeing someone once a month for an hour, because therapy is about me being able to put myself in your shoes. So I don't know how I would do that if we don't see each other that. So maybe see your therapist more frequently is my point, and also tell them explicitly, this is what I want to work on. Are you willing to learn or not? And that's it. And no, freely, if they want to learn, just give them my email and tell them I will guide them through the entire process. Um, a suggestion for a future webinar I have is dealing with damage after the storm. So much of the conversation around skin picking is on reducing or stopping the behavior, which is certainly necessary. But once things are in a better place with the behavior, more guidance for coping with the damage would be very helpful. I agree. Let me write that down also. It's something that I will talk about with my clients if they want to, but you're right. We should absolutely have a webinar on that. Um, let me just write it down and I'll go back to the questions. So I will put that on the list for next month as well. Let me see what time it is. Okay, we can have time for one more question. Let me choose something randomly. Any advice on how to manage skin picking while traveling or moving? Try so what would cause moving is one of the more stressful things I feel like we can experience. In those situations, what's important is to preserve as much of your daily structure and routine as possible. So try to have at least your morning routine intact, and try to find some time for yourself to de-stress in whatever way you de-stress. And in terms of techniques to manage picking in that period, I would focus more on stimulus control rather than anything else, because stimulus control is, the most carefree method that I know of. For example, wearing gloves, you don't really have to think about much anymore. You wear them and you can pick, and that's it. Because if you have all these things going on with moving, and that means packing and unpacking and new apartments and old apartments, I think you should go for the safest techniques, those that will make sure that you pick as little as possible. So stimulus control plus routine and a little bit of time every day to de-stress. So that would be like the most general response that I can give. Okay, so let's stop here. There are some questions that I didn't answer, and I apologize. You can either email them to me, or you can join the promotional webinar and then ask questions again, because that one is short and I can allocate the same amount of time. We can have a longer Q&A. I hope it was useful, and see you next month. Bye, everyone.